clients and nurses can also be a barrier. Cultural shock or isolation, discomfort, and disorientation felt by someone trying to adapt to a different culture can be a barrier to delivering or receiving culturally competent care. And one more thing to remember. Never assume, based on name or appearance, that a client belongs to a particular cultural group or belongs to just one cultural group. You have to talk with your clients to find out what they believe and what they value. Nurses also have to set aside any biases they have about clients and consciously strive to avoid ethnocentrism. Keys to the success of providing culturally appropriate health care include developing cultural self-awareness, being culturally sensitive to other groups, being aware of other cultures, respecting other cultural groups, designing care specifically for the client based on specific needs, and learning the health practices of other cultures. Over the past 100 years, this nation has seen remarkable improvements in the quality of life for many Americans. Life expectancy has increased dramatically, infant mortality has dropped substantially, and there has been significant change in the causes of disease and death, with a major shift from acute to chronic diseases. Unfortunately, not all Americans have benefited from these advances. People of certain racial and ethnic groups have not enjoyed the same improvements in health status as other Americans have. The morbidity and mortality rates for many diseases is disproportionately higher among African Americans, American Indians, and Alaskan Americans, Asian Americans, Hispanic Americans, and Native Hawaiians. Studies consistently show that select minority populations have higher rates of infant mortality, diabetes, heart disease, HIV/AIDS, and other health problems. These problems translate into poorer general health and reduced life expectancy. This is a major reason why health disparities were chosen as one of the goals in Healthy People 2010. Asian Americans and Hispanic Americans are the two fastest growing minority populations in the United States. Minority populations often experience inequitable access as well as underutilization of health services. Immigrant populations can experience language barriers, illegal immigrant status, or lack of preventive care. Community health nurses come face to face with all of these issues, making your delivery of culturally relevant care absolutely imperative. Respect and acceptance of cultural groups is a prerequisite for helping these populations improve their health status. A cultural assessment can help you gain valuable information and insight that will help you have a positive impact on your client's health status. Your cultural assessment should cover the biophysical, psychological, and social dimensions, including interpersonal relationships, communication, demeanor, beliefs and values, spirituality, and economic status, the behavioral dimension, including dietary patterns, life events, and sexual practices, and the healthcare system dimension. And speaking of spirituality, all too often clients' spiritual needs are overlooked or negated. Spirituality involves one's personal interpretation of life and the meaning of that life. For some clients, spirituality includes religion, but the concept is actually much broader in meaning. Spirituality is an internal belief and it's very individualized. It also includes one's values and can vary from person to person, and as the same person changes throughout life. Part of what you'll do for your clients is evaluate their spiritual health. Determine each client's concept of God or deity, if they have one, their source of strength and hope, their beliefs about the meaning of their existence, any significant religious or spiritual practices, and whether or not they feel that spiritual beliefs and health are interrelated. Spiritual distress is a common phenomenon, especially in critically or terminally ill clients. Spiritual distress is a disruption in life's principles that pervade a person's entire being. Factors that can contribute to spiritual distress include awareness of aging, separation from significant others, culture or religion, disfigurement, chronic pain, disability, unresolved feelings about death, anger towards God or deity, and life circumstance that challenges one's belief or value system. What can you do to address spiritual distress? Appropriate interventions include fostering integrity in your clients, promoting interpersonal bonding, respecting and enhancing their quest for the meaning of life and death, listening to your client's concerns, and acting as a resource for them. The key here is remaining non-judgmental, especially when your client's views are radically different from your own. Remember, your care is all about the client, not about you. By its very definition, a community is the common thread connecting all its residents, young and old, families, and individuals. This diversity creates age-specific considerations that apply to community health. Let's begin by looking at families, particularly the childbearing family, because of the majority of people in most communities fall into this category. Families provide the primary source for healthcare decision-making by providing and managing the healthcare of family members. Today's families face an enormous responsibility for providing healthcare to older family members, plus they have the added responsibility of socializing and raising their own children. Various developmental tasks have been identified for the childbearing family. These tasks include stabilizing the family unit, reconciling family members' conflicting developmental tasks, and helping the parents and children address their developmental needs. The challenge to you as a community health nurse is to make sure the childbearing family gets appropriate care. Your first step is a family assessment. That includes the family's self-care patterns, demographic data, community affiliations, communication style, decision-making patterns, child-raising practices, and socialization, as well as the family's values, conflicts, goals, strengths, resources, and concerns. You'd evaluate the family's self-care patterns by exploring their current health protection and preventive behavior, physical and recreational activities, sleep patterns, stress management, family relationships, environmental control, information-seeking patterns, and how they use health promotion facilities and services. Finally, you'd assess the family's health goals. Next, based on the family assessment that you've just done, you'd identify potential or actual health problems. Those are your nursing diagnoses, and you'd use them to plan how you will help improve the family's health status. You'll work with the family to develop target health goals and objectives. These goals and objectives will help you develop appropriate interventions. After you implement the interventions, you'll evaluate their progress towards positive outcomes. This is no easy task. Community health nursing roles for the childbearing family include monitoring prenatal care and referring for management of pregnancy problems, counseling about family planning, teaching parenting skills, counseling about nutrition and exercise, coordinating pediatric services, supervising immunizations, educating about normal growth and development, facilitating interpersonal relationships, referring to social services as needed, monitoring childhood development, coordinating pediatric services, and counseling about environmental safety in the home. One of the most visible healthcare professionals through a child's eye is the school nurse. The school nurse has a vital role in helping families maintain their children's health. The school nurse's role has expanded as more and more physically and psychologically challenged children are mainstreamed, that is, integrated into regular programs and classes. Additionally, there has been an increased demand for alternative healthcare sites and a lack of available healthcare. Now more than ever, school nursing is vital due to the hazards of the school environment, children's need to learn effectively, the demand to foster the development of healthy adults, and the need to protect and enhance community health. Can you identify 3 primary components of a school health program? The first would be health education, and it must focus on cognitive and effective learning. The second component is health services. That means case finding and appraisal, data collection and documentation, counseling, health promotion and disease prevention, case management, remedial or rehabilitative services, specific nursing services, and emergency services. The third component is the health environment. That includes the physical, psychological, and social environment. Overall, the school nurse has a responsibility to students, families, school employees,